So I'm Shawn Barigar. I'm the president and CEO of the Twin Falls Area Chamber of Commerce, and we're happy to partner with St. Luke's and South Central Public Health today to share some information about sort of the current state of COVID here in the Magic Valley, and as we're looking at vaccine availability and also the science behind the vaccines. Our presenters today include Dr. Joshua Kern, Vice President of Medical Affairs for St. Luke's, and Logan Hudson, Public Health Division Administrator for South Central Public Health District. This is the first of these webinars that we're doing, and we plan to do a series of these over the coming weeks as we gain new information about vaccination and the fight against COVID-19. A couple of participation guidelines today. So this is set up that you'll be hearing from us. You are welcome to participate with questions, and we ask that you throw those into the chat window. So that's on the right-hand side of your screen. You can type your questions in the chat. I'll serve as moderator and kind of compile those and throw those to Dr. Kern and to Logan as we go through. We would please ask that you be respectful. The goal is to share ideas and information with as many individuals as possible, but this is a limited public forum. We would ask that you lay off profanities and obscenities and those types of things as we go through and share this information. The rough agenda today, again, we're going to update you on the status of COVID-19 in our region and in Idaho. We'll have some discussion of the vaccine science and effectiveness, vaccine distribution status in our region, the current vaccine eligibility, and planning for the future vaccine eligibility. And again, we'll have an opportunity for questions. So we appreciate everyone being here today. And with that, we're going to get started with Dr. Joshua Kern from St. Luke's. We'll turn it over to you, Dr. Kern.
Yeah, thanks, Shawn. I've looked at the attendee list. I can see names that I recognize and names that I don't recognize. For those that don't know me, I am a family physician that practices in Jerome. Much of my time now is taken up in the role of Vice President of Medical Affairs for St. Luke's, and I have been involved with our COVID incident command and COVID response as a health system from the very beginning. So I'll say that I've spent a disproportionate amount of my time in the last year, unfortunately, thinking about COVID and working on COVID. I will talk sort of briefly about the vaccine, the technology, and try to get out in front of some of the things that we hear about the vaccine that maybe are not what I would consider to be the full facts about it. I'm focused mostly on the Pfizer and Moderna. Those are the two that have the FDA approval and are being given in the United States. Johnson & Johnson is probably pretty close, but it hasn't officially been released yet. So again, my focus is on the Pfizer and Moderna, which for all intents and purposes, I would say are very similar vaccines. These are a relatively new type of vaccine called an RNA vaccine. And it is a different technology than what our historical vaccines have been produced. And in a lot of ways, I think will be superior and eventually will probably be the way that we make vaccines going forward. I think one of the things that you hear out there about these vaccines is that they were rushed to market, or some concerns about how quickly these vaccines did come out. But the reality is that some of that has to do with the inherent advantages of this new technology. In fact, the Moderna vaccine was actually produced within a week of the COVID virus being DNA sequenced. And that's the power of this RNA technology, is that as soon as you get a DNA sequence of a virus or another target for making these vaccines, you can really actually start producing the vaccine very quickly. The other thing is that a lot of people don't realize is that we've been testing this technology for several years, not just, this isn't totally new. They've in fact made an Ebola vaccine using this technology. They've made a Zika vaccine, which you remember we heard a lot about a couple years ago, 2 years ago. And in fact have been using this same RNA vaccine technology to try to fight cancers, eliciting an immune response from our own bodies to attack different types of cancers. So it's not that this is totally new. Oh my gosh, this came out of nowhere. We've been working on this technology in science in the United States and other countries for quite some time, up to even 15 years. Different versions of this technology has been used. So they went through full phase 2 trials on both of the vaccines that I'm talking about. The Pfizer and Moderna trials were shown to be very safe and very effective up to 95, 96% at preventing you from getting COVID. And that's really the goal, is limiting the spread of the virus through getting widespread vaccination. One of the other things that I've kind of heard is, we should try to get herd immunity by just letting the virus spread naturally and letting the immune system do it. Well, even as bad as things got here in Magic Valley, which was pretty bad, September, October, we had an incredible number of deaths and an incredible number of hospitalizations. You've probably seen that in the media back then. We still probably only got to 25 or 30% of the community that saw the virus. So that still means 70% of us out here in the Magic Valley have not been infected with the virus. And there's really no way to get up to herd immunity without causing undue death without a vaccine. So really the vaccine is the future that we've been waiting for to get past this pandemic. We have now given 55 million or more vaccines in the United States. Again, the safety profile is bearing out similar to what was seen in the trials. About 12% of all of Idaho residents have gotten the virus or the vaccine at this point. And again, we're seeing much better results getting the vaccine than we are getting the virus. We have seen a very low number of what we would call actual severe events related to the vaccine. The tolerability of it is pretty good. We do see people get an immune response from it. And so some people do get kind of variable symptoms. I myself have had both shots, and I had a fair amount of fatigue for about 24 hours, particularly after the second shot. Some people get fevers and chills for a day or two. Interestingly, it's just your immune system eliciting a response, and really no way to spread that fever to anybody else. You're not infected. There's no actual virus in your system. I'll talk briefly about, I see a question from Trevor there, and I'll expand on that in a second. I'm going to talk a little bit more about the technology. mRNA is something that works in our bodies that codes the genetic sequence for making proteins. So we have mRNA going to work in our bodies all the time, every day, in all of our cells continually. And so the way this vaccine works is it has a short segment of RNA that codes for the sequence of the protein of the spike protein. If you picture the way the COVID virus looks in the pictures that we've all seen over the last year, it's a round circle with spiky things poking off of it. Those spiky things are the spike protein, and Moderna and Pfizer both picked that as the target for their vaccine. So this piece of RNA goes into your cell. It has your body make that segment of protein. That protein then goes into your bloodstream, and your body recognizes that as being foreign, and it elicits an immune response. The RNA, like all RNA, then is broken down, because RNA is a very sort of transient thing. So the actual evidence of the vaccine completely goes away. Your body then clears those spike proteins and then makes antibody. So the question from Trevor, I think actually in the studies, the phase 2 trials for both Pfizer and Moderna, it actually was 95% protection against getting the virus at all. There's more and more conversation around protection from severe cases, I think because of the Johnson & Johnson vaccine, which has not been shown as effective at preventing any kind of infection by the virus, but still is having very high level protection against severe disease, and it's only one shot and easier to store. So I think there's been a lot of conversation around that kind of protection against severe disease, while the trials on the Pfizer and Moderna actually showed essentially 95% protection against getting infected at all during those phase 2 trials. Now, with the variants that are out there and long-term real life living, meaning potentially getting exposed to the virus more than happen in those phase 2 trials, the overall effectiveness may go down. But the number 95 that I'm referring to is the phase 2 trial data from both the Pfizer and Moderna. And I forget the exact numbers. It's somewhere between 95 and 96 or 94 and 96 between those two trials, which included 60,000 people, which is, a reasonably large trial. And now we're doing the large scale trial of 55 million people in the United States who have gotten the vaccine, and we'll see how protective it is against some of these variants that are coming out, and the longer term impacts. So those were my prepared remarks, kind of talking high level, kind of staying pretty surface level on how the vaccine works, getting in front of some of the conversation I've heard about it was rushed, or there are super high side effects, or the side effects of the vaccine are worse than the virus. All those things are not true, and I'm happy to answer more questions as we get to the Q&A part. I will mute myself and pass it over to Logan to talk more about vaccine distribution.
Sounds perfect. Thank you, Dr. Kern. And Logan, we'll turn it over to you to talk a little bit about kind of vaccine availability and what the health district is doing here in the Magic Valley area.
All right, thanks, Shawn, and thanks for having me on. Like they said, my name is Logan Hudson, and I am Public Health Division Administrator with South Central Public Health. I know everyone on the call is anxious to get this vaccine, and we are anxious to give it to you, and we would give it to everybody if we had it right away. As Dr. Kern said, we know it's safe. It's an effective way to prevent the COVID-19 disease. But as we get closer to launching this group of people, the essential workers, we're getting quite a few questions on how that's going to look, how public health is going to manage it. And so I was going to talk a little bit about that in my opening remarks. But before I go there, I kind of want to give a brief background on how this works, starting at the federal level with vaccine distribution. There's some misconception out there that we here at South Central Public Health control a lot more things than we do. And we really don't have as much say in how much vaccine we get in our communities as people would have us think. The federal government and the vaccine manufacturers decide how much each state is going to get. And then once the state receives the vaccine or receives a number, our Idaho Immunization Program, the governor's office, they then decide how much vaccine will go to each public health district. The state of Idaho has 7 public health districts. So they break that up by percentages. I believe we're around 12% of the state's population in the 8 south central Idaho counties. So we get roughly 12% of the vaccine that comes to Idaho on any given week. So not very much. We love our rural nature here in southern Idaho, but it certainly makes for less vaccine when it comes time to divvy it out. And then when it does get to South Central Public Health, we then ship it out to the different providers, such as St. Luke's or Family Health Services, any provider that's signed up. We try to ship it out as equitably as possible to each county based on population. At times, when we were doing specific groups of teachers or medical providers, we had to send more to some counties that had like hospitals in them and less to others that didn't. But once we opened up to the 65 plus crowd, we're pretty much sticking to the percentages by county to get it out and make sure every county gets its fair share of the vaccine. But what we're really running into now, and I think most people know this, are supply issues. Once we opened up to the 65 plus tier on February 1st, the demand for the vaccine far outweighed our supply, and by tens of thousands of doses, not just by a few doses, but tens of thousands. Almost every provider that's giving has wait lists that are in the thousands. And we saw this coming, and that is one of the reasons why the state chose to vaccinate long-term care facilities first, healthcare providers first. Some of those groups, they really needed to get them done before they open it up to that next category of 65 plus. But as we get kind of through this group, we're getting closer to thinking about the essential worker group. And in our area, ag workers are in that essential group, as are grocery stores and convenience stores. And that's a very large population of people as well. It's been a population of people that have kept a lot of us up at night, and trying to think about how we're going to get all of this vaccine, or this little amount of vaccine, out to everybody. Some of the questions we're getting, one of the big ones is, when it comes and when this group opens up, how is my facility or my business going to get the vaccine? And the answer to that is, it depends. Right now, we can't plan any mass vaccine clinics whatsoever. We're just not getting enough vaccine. To think the thought of holding back 1,000 doses or 500 doses to plan a mass vaccine clinic for like a food manufacturing facility, for example, just wouldn't work. We have too big of wait lists in all of our clinics to even fathom that. More than likely, when the group, the 2.3 group rolls out, it's probably going to go to, or be similar to how we're doing it right now, with just appointment slots in clinics. There's going to be some overlap between the groups. The way that the state has opened up the tiers right now, they're not waiting until one is, completely done. I don't think they're going to wait until the 65 plus is even close to being done before it opens up. So probably what will happen, just guessing, is when we open up this tier, the employees in your employees or employers will have to, if they want the vaccine right away, will have to get in line. As more doses come in, and we keep getting told that in March more doses are going to come, I think part of that is because Johnson & Johnson might come on board in March. We've also heard that Pfizer and Moderna are ramping up production, decreasing the amount of time that it takes to produce a vial of vaccine. So we may get more in March. But as more doses come in, if we start to get to levels where we can set aside vaccine, that's when we'll start looking at, coming out and doing mass clinics at a particular site. But I just don't see that happening right away. And that's the biggest question we're getting from employers, is how are my employees going to get vaccinated? And I think the answer I have is they will get it, but it's gonna take some patience and some work on everybody's part. If the governor comes out and says tier 2.3 is open April 1st, that does not mean that everyone that works as an essential worker will get a vaccine by the end of April. It may be May, it may be June, maybe even July before we get through it. It's a very large group, and it's going to depend on how much vaccine we get. The second big question we get is, who decides and why am I not in this group of people that get this vaccine? And if it was up to me, I would just give it to everybody that lined up and wanted it. But again, we have a limited supply, so we have to prioritize. And there's a group of very smart people up at the state up in Boise. Sorry when I say the state, I'm usually talking Boise. It consists of some physicians, some lay people, some business owners, some political folks, and they get together every couple of weeks and they decide who's in what group, or what group we're going to be on, and then sub-prioritize within that group. And as we get to a group, they tend to look at that group a little more closely and sort of, I guess, sub-prioritize who else in that group should get the vaccine. Public health maybe can give some input and throw out some emails up there, but we really aren't the ones that make that decision. We just carry out the orders, so to speak. I know on the state COVID vaccine website, there's a list of the 2.3, and it's very short. So I think as we get closer to 2.3, they will have to parse that out, stratify that out a little more, because it's really broad right now. We get a ton of calls every day about what group am I in, how come my group isn't, or how come my tier isn't here, or where do I fit? And we do our best to try to talk with people or work people in if we think they are, but oftentimes the answer is right on their website on who we're working with and who's eligible for the vaccine. And that website is just the coronavirus.idaho.gov, and we also have links to those web pages on our site as well. So just before I end my comments and we get into the questions, just encourage people to again be patient. We're going to do our best to get everybody vaccinated, and as vaccine comes in, we feel we have a pretty good provider infrastructure. I believe we have over 50 locations in our health district that are signed up to give vaccines. We just don't have a ton of vaccine to give them. But as it comes in, we know that they're ready. They're calling us every week, angry that they can't get more. They want to do more. And so once we get there, we think the infrastructure is in place to hammer out a lot of vaccines in a week. And I think that's all I've got, Shawn.
Great, thanks, Logan. I think you sort of addressed this question that came up in the chat, that an example of Buell Drug ordered 850 vaccines this week, but was only allocated 20. Our smaller towns receiving less, but I think you really touched on, we have the larger amount coming to the state that's allocated by population to the district. Then when you're distributing that to your partners who are available to give those, are you doing that by population as well?
Per county, yes. And so I don't think I talked about the number we're getting, and we're receiving roughly 2,500, maybe some weeks 3,000 doses a week. So a pharmacy such as Buell Drug ordering 850 would be taking, if we gave them all 850, they would be taking over a third of the vaccine for their organization. And so it's definitely something that we look at, but we're kind of staying at the county level and not the town level, knowing that people may have to travel to get the vaccine if the local pharmacy in their town doesn't have it or has a small amount.
Great, and we'll get into the tiers, sort of the 2.3, 2.4, and on a little later. I want to back up just one step with Dr. Kern. So we're talking about vaccine, which is part of the mitigation efforts for COVID. What is sort of the snapshot of what the Magic Valley is looking like right now as far as COVID infection, severity of illness, those types of things?
Yeah, I mean, we're much lower than in the past. We're operating now at a hospital standpoint at essentially regular operating levels. Here, the last couple days, we've had less than 10 patients in the hospital with COVID, which is back to the kind of numbers we were having during the summer when things were not that bad. And then we started seeing the surge in September, October, November, where we were up to 60 patients at a time in the hospital with COVID here at Magic Valley. The numbers in the community have kind of gone down. We still see it spreading in the community. The numbers last week were a little bit higher than the week before. But again, in that under 100 in Twin Falls range, down from 600 at the peak. During any given week, we were diagnosing about 600 a week. And keep in mind that the positivity rate is down too. So when we were seeing those high numbers of 600 in a week, we were also probably missing a lot more disease, meaning a lot more people were probably sick than we were diagnosing. And now positivity rate is way down, the numbers are way down. So things look pretty good. They're improved. Of course, every time we get like that, it tends to surge back up again. So that the concern is that people will get complacent and start ignoring the precautions. And I do think you can kind of see that in the community is already in the last few weeks, you've seen a kind of dropping off of people wearing masks and following precautions. Some percentage of those people maybe saw the virus during our surge, so they may not be spreading the virus as much anymore, but still a lot of us have not seen the virus. So that's a concern.
Thank you. And Logan, to chime in maybe throughout the health district, so certainly Twin Falls County is sort of the population center, but your district covers 8 counties. Is it similar across the other 8 counties? I know Blaine County has seen a little bit of an uptick recently.
Yeah, so we've seen a market decrease through 7 of the 8 counties. Camas County, where Fairfield is located, is a little bit of a challenge to use a rate per 10,000, because they can have 1 case and it takes them into the critical level. They have such a small population, but so they kind of go up and down if they have 1 case in a week. But the rest of the larger counties, Twin Falls, Jerome, Cassia, Minidoka, Gooding, they're down to levels we haven't seen since last May, when everything was shut down, and then again in August, right before school started. We saw these dips, and like Dr. Kern said, our positivity rates they're actually getting lower than we've ever seen them. There's a couple counties that it's less than 5, which we haven't seen that since it started.
Great. There was a question that Dr. Kern answered on the chat there, basically asking, if I live in Twin, can I get my vaccine in Jerome, and vice versa? Basically wherever you can sort of get on a list and get in, if you're in the eligible tiers, you can do that. There's not a requirement to stay in your own place. Maybe Logan, could you kind of talk through, or either one of you, if I'm 65 plus, I'm in an eligible tier now and I haven't received the vaccine, what's the best way to go about getting it?
I can go first because I'm not sure what St. Luke's in terms of wait lists are doing, but we have a link to a wait list on our website, and we are getting requests from other providers to share that wait list, and so we're sharing it as well. So when we get ready to schedule, and we're only scheduling a week or 2 out because we're terrified that we're going to schedule people and then not get vaccine. For example, the weather back east this week has delayed all of our shipments, so we may not get any vaccine this week. We're just kind of in a holding pattern. So we're not scheduling too far out, but we have this wait list, and then we just dedicate people to start calling off the top and get there. We're prioritizing one clinic a week for 75 and over, because we do know that group even has more challenges with the disease, but that's one way to do it, and I'll let Dr. Kern speak to what St. Luke's is doing.
Yeah, we're doing all of our scheduling about now 2 weeks in advance through our MyChart for the most part, and that assures that there's always a vaccine for you when you get your appointment made through MyChart. So using that technology to assure that we're not making any appointments and leaving people out. And again, we wish that we could just make as many appointments as possible and fill it in over the next couple of weeks. But to Logan's point, what we don't really want to ever have to do is call somebody and say, hey, you had your appointment for tomorrow, but we don't have enough vaccine for you, so go find another one. So we're really just making it one-to-one. As soon as we know how much vaccine we're getting, we're scheduling appointments for that period of time going forward. So that's kind of how it works for St. Luke's through the MyChart. To Don's question, if I live in Jackpot but my PCP is in Twin, do I qualify for the vaccine in Idaho? Really, there's not any kind of limitation about where you live. I had joked to my mom at one point, who lives in Washington, like, okay, hey, how soon could you get here? Because I know one of the pharmacies has some doses this week. But yeah, it is a little bit of that. You kind of just go where you can get the shot. And I know that St. Luke's did a big vaccination event this last weekend and did 1,000 people this last Saturday. And there were people here from reasonably far away. I think they were all Idaho residents, but some from Boise, some from Canyon County, some from McCall even had scheduled appointments. So we're running into that problem of just the demand is way higher than the supply right now. And we would love to give out all of our shots and get everyone done tomorrow if we could, but we just don't have the vaccine.
There have been a couple questions kind of talking about where people land in the tiers, and to Logan's point earlier, that's not really in any of our wheelhouse. We're not the decision makers on who goes in that tier or who doesn't. However, the state has a pretty good website that has just been updated in the last couple of weeks that Health and Welfare has, and I am going to screen share that here to show people.
I see Jim's question about being an organ donor, and I'm assuming that's just you're signed up to be an organ donor. That would not put you in a different tier. If you had had an organ transplant and had like a kidney or something, then that would potentially move you into the higher risk category that we're about to look at.
Yeah, so this website is on healthandwelfare.idaho.gov, and you find it's when and where to get your vaccination. So as you scroll through the page, it talks about the adults 65 years of age and older, and then vaccinations continuing for this long list of folks who were in the initial tiers with, frontline healthcare workers, emergency responders, hospital staff, and so forth. As Logan was saying earlier, the future tiers are relatively short, but as you look at this was really like 4 things that now is, 40, as they sort of drill down into greater detail of what that means. So when you look at the Idahoans who are up next, you have these rough dates. And I think it's important to take these a little bit with a grain of salt because it is supply and demand to a certain extent. Initially, when this list came out, there was thought that these food and agricultural workers and so forth might be in mid-February. Well, we're in mid-February and we are far from those folks. So this site has been updated that's potentially now early April when that tier may open. That doesn't mean everybody gets it then based on supply. So you can kind of see who's in that next tier. Then later you have other essential workers. So that would be folks who aren't necessarily grocery convenience and so forth. And folks with high risk medical conditions. And then you get to the general public after that. So again, this website is a pretty good place to sort of see what's teed up, understanding that those dates are pretty fluid as it goes forward. Dr. Kern or Logan, anything you want to add on that?
Well, right before this town hall, I was on a call with the state Idaho Immunization Program, and they were speaking of this. And I like you said, these are rough dates. I think I touched on the fact that the state is expecting a fairly sizable increase in doses per week starting mid-March. And I think that's kind of where these numbers are coming from. I don't know. Again, I think part of that's the Johnson & Johnson vaccine coming out and the Pfizer and Moderna vaccine manufacturers increasing a little bit, but I don't know how much more we're going to get. And if getting to those tiers on time is their goal, and so that's why they're saying that and pushing for us to get more vaccine. But I think if they open it, just because, again, if it's open, it doesn't mean that everyone in the tier before them is finished and we are just going to pivot and move on to the first food manufacturer that raises their hand. I think there'll be a lot of overlap between the 65 plus and then again, I think they'll even probably look at that tier and maybe even stratify it even more to say, we're only going to do, grocery store workers first or however they choose it. And it'll even be broken down even more.
Dr. Kern, I'm going to throw this one at you. There's a question that's come in about, could you comment on those who for religious, medical, or personal reasons choose or are not able to get the vaccine? Do you anticipate they will not be allowed to work or travel at some point, that there may be restrictions put on folks into the future who aren't vaccinated?
Yeah, I mean, I think there's been a lot of conversation about whether there would be vaccine passports or, you'd need to prove X, Y, or Z to be able to do things. I think that seems very unlikely in the United States, only because we have not typically done that kind of thing. In the United States, we've tended to balance personal liberty at times even over sort of the public good. And so to me, it seems unlikely that we would suddenly pivot to requiring a vaccine passport. Now, that said, I'll use the example of influenza vaccine. So in St. Luke's, we require our employees to have an influenza vaccine. So during non-COVID times, we'll go back to last winter, if a person for religious or other reasons could not get an influenza vaccine, they had to wear a mask at work, just like we're doing now all the time for COVID. So there may be private organizations that can make decisions about what allows somebody to utilize their resource or what they require of their employees, but I would be doubtful that there would be sort of widespread governmental decisions on those things. And we've kind of strayed out of medicine into politics, where I look at Shawn to say, Shawn, dig me out of this hole. I shouldn't be answering this question. You should be answering this question. But that's where I would how I would answer that.
That actually raises a good point. I think as we've all dealt with the impacts of COVID for the last 12 months, I have found it striking how quickly it became such a politically charged issue, almost as opposed to a health issue. And again, I think the goal of these discussions is to try to stick with the science and the health data, but certainly we understand there are political implications. But I thought you did a great job answering that question, Dr. Kern. So there's another question here. How many people are estimated to be in the food and ag worker group? I don't know if, Logan, if you have a take on that. I actually just jumped on the coronavirus vaccine committee website. I'm trying to find it there. I know the 65 plus group is around 265,000 people, I think. And the governor yesterday was saying 90 some thousand have had, I think, maybe at least one shot. So we're maybe a third through at least an initial dose for that group. I'll continue to try to find that information, but it's got to be in that neighborhood.
I want to say, and I recall something about around 220,000 statewide in that group. So if we're on par and we're 11 to 12% of the population, that's kind of what we're looking at. If anybody wants to do that math, it could be more, because I don't know who they're including as an essential worker yet, and what they say frontline workers, essential workers. They have these different verbiage for them, and so I'm not sure who is what yet in that, but I want to say it was around 215 to maybe 230 for the frontline workers.
Yeah, and I know that so that committee meets, I think, every other week, where they're kind of reviewing and further stratifying those groups. They have groups come to them saying, hey, we'd like to be bumped up, and those decisions are made and then recommended to the governor, and the governor's making those final decisions. But yeah, I know with even just food processing and agriculture is a large chunk. Then you throw in grocery store and convenience, which is another piece. Then you have other essential workers, which is a pretty broad term, and who's going to exactly define that. So what, million 8 people in the state. So we're rolling through some of those. Question: after you get your first COVID-19 vaccine, do you automatically make your appointment for the second shot?
That would be my recommendation for any provider giving COVID vaccine, is before the person leaves, go ahead and make that appointment. We have run into a few situations where people receive their first vaccine while out of state. Maybe they have a second home somewhere, or they were visiting family or something, and they need to get their second here, and those are a little bit challenging, but we've dealt with those and found places for those folks to go get their second.
Yes, I can't speak for all pharmacies or other people giving the vaccine, but that's how St. Luke's is doing it, is scheduling your follow-up shot at the time of your first shot.
Are there further questions that folks have? I think we've touched on most of them that came through there. Again, our intention is to continue to have this kind of a format periodically. We don't know exactly what that time period is going to be. We don't want to have webinars for the sake of having webinars, not having new information to share. Understanding that the only thing we've learned the last 12 months that is certain is uncertainty. So as we sort of manage through the information, we want to be sure that we're getting that information out. Initially, our intention was we thought the purpose of this would be talking to that 2.3 tier about how are we going to do vaccinations for food processors and so forth. We're not quite there yet, but I do think one thing that folks who are in those future tiers, particularly employers, can be doing is preparing your employees to be ready for when that's available. So that's sharing information about vaccine efficacy, the information that's out there about pros and cons, and helping people make those decisions so that when that's available, they're ready to jump into that queue.
Shawn, you did have a couple of questions that came in beforehand that I don't know if we've gotten to. Do you want to ask those for the group?
That is a good point. I knew I've got too many papers in front of me here. So one question that came in was talking about whether people have the ability to choose which vaccine they get. Currently, that's Pfizer or Moderna, or later Johnson & Johnson. Now, there are different waiting periods. With Johnson & Johnson, it's just going to be one dose. Are people able to make that choice?
Not at our facility. I mean, if we call and schedule you, you get what we have that day, and we brought out of the freezer. I know St. Luke's Magic Valley is only doing Pfizer, so if they really want Pfizer, they can get on their list, and that's about all I know. The only way they can make a choice.
Yeah, and I think most of the pharmacies have Moderna, isn't that right?
Yeah, it goes back and forth depending on what we get, but yeah. I think if they wanted to call, they could, but once your appointment's made, I don't recommend at that point just deciding you would like the other one.
So for the most part right now, to use a little bit of a blunt phrase, beggars can't be choosers. If you can get in there and get a vaccine with 2 right now, that's probably about what you have. Right. Perhaps when Johnson & Johnson comes online, or any future ones, there may be more of an opportunity to be selective about where you would go to get your vaccine, depending on who might have what.
Yeah.
Just for an anecdote's sake, if we were open to the full population and my wife qualified, I would get her whatever shot I could get an appointment for her. I would not be worried about which one it was. Now, down the road with these new variants, there may be the possibility that we need to get boosters to adjust to the variants. But in the short run, getting some or even a high level of protection is way more important than trying to be choosy over which one you got.
One of the other questions that we received in advance was, again, kind of talking about where people land in the tiers. I'm one of 5 siblings caring for our 85-year-old mother and Haley. How can we get vaccines as caregivers? Please. Really, this is more lobbying, I think, than the question. But I know one of the comments I heard yesterday in a meeting I was in is, once your 85-year-old mother is vaccinated, the good news is she's the one who can't get it from you.
Yeah, agreed. I don't think in-home caregivers have been prioritized as a priority group. So to that point, if you yourself don't really have high-risk medical conditions or are under 65, you wouldn't qualify for the shot. But the punchline is to that point that your then loved one is protected. And so the risk of them getting it would be very remote from you.
And then another question was specific to asking, is it safe for someone with multiple autoimmune disorders to get the vaccine, or will it trigger a flare for those with those conditions? And I know you don't want to dispense broad medical advice, Dr. Kern, but maybe your thoughts on that. Is that something people should just be following up with their own physician about?
In general, yeah, you're going to want to talk to your rheumatologist or whatever group of doctors helps take care of you. I think in general, the recommendation would be to get the vaccine because, again, far greater risk from the native virus. That said, depending on what conditions the person had, there may be timing issues around when to get the vaccine related to some of their medications. Some people with autoimmune conditions are on immune modulating medications that do change when you should get the vaccine. So that's, again, working very closely with your provider that's prescribing your immune modulators or taking care of your autoimmune conditions.
Great. One other comment in the chat room there saying this person found out about the webinar through the Jerome Chamber. Can we please advertise these in some other places? So we will certainly make a more concerted effort to get that information out. We did share this out with local media partners and certainly through the business community this last week, but we will do our best to get the information out there when these future ones are coming up. Maybe just a couple of other questions to touch on before we wrap up here in just a couple of minutes. And maybe so this actually was a question that came in. Should I get a vaccine if I've had a prior COVID positive test result?
Yeah, definitely. The CDC, I jumped Logan because he was on mute. The CDC recommendation is definitely to get the COVID vaccine, whether you've had COVID or not. The general guideline is to wait until you're fully recovered before getting the vaccine. And the science reason behind that is we know at this point the vaccine definitely gives high level of protection. When your native immune system makes an antibody, it sort of chunks up the virus and kind of just picks a target without it really being targeted and knowing whether you're going to get lasting immunity. We've definitely in our community in Wood River and in Boise seen patients that have had recurrent infections, meaning got COVID in the spring and then got it again in the fall. So the native virus does seem to not always give lasting immunity. And we right now feel like the Pfizer and Moderna vaccines do give a good immunity and a boost to the probability that you'll be protected.
And I would just add, if you meet the criteria to get it, i.e. you're not sick, you're no longer sick, it's been at least 10 days, you might as well keep your place in line, because if you get out, it might be a while before you get back.
And a question that's come up and I've heard varying answers to, how long will the vaccine be effective for folks? Or maybe even the question too, if someone's had COVID and hasn't had the vaccine, what immunities might they carry?
Yeah, we don't actually know the answer to that for sure. The CDC has, for all intents and purposes, put out guidelines that if you've had COVID, you're considered immune for 3 months, but again, considered not immune after 3 months. And again, the vaccine is young enough. We don't know if we're going to need annual boosters, anything like that. So that data is being gathered because we're doing it real time as we all get the vaccine and see what our risk then for getting COVID is. There's a lot of reasons to think that it will give more lasting immunity than just a short period of time. But again, the science isn't settled because it's new enough that we can't say for sure.
Great. Well, I think we've answered all the questions that we had and some of the thoughts that we had. Any final closing thoughts from the two of you, Logan?
Just kind of what I tried to impress on people at the beginning is just be patient. Hopefully we can continue to do these and we'll keep you updated. It's definitely a marathon and not a sprint. If we get more vaccine, we can certainly pick up the pace a little bit. If we get more providers on board and more vaccine, we can maybe start running a little faster than that. So just hang in there and we'll keep you updated. And again, our goal is to get everybody vaccinated because nobody wants to be done with this more than public health and St. Luke's and everybody. And it doesn't do us any good to wait. And thank you guys for your time.
Yeah. Same message from me. Just, I saw the comments expressed in the chat about how difficult it's been to get an appointment. We know we're working on it. The day that the vaccine opened up to 65 and older, it actually crashed the entire phone system in Boise because of the number of phone calls coming into St. Luke's. So it's not just because we weren't organized or anything like that. It just the crush of demand has greatly exceeded the supply. During a normal influenza year, you just kind of roll into your clinic and you get it whenever you want, and people kind of take their time and don't feel pressured. But everyone wants it as soon as possible so that they don't have to deal with the virus themselves. So, to Logan's point, we're all happy to get shots in arms and start protecting our community. And again, to that point, protecting people from being in the hospital, protecting our providers, protecting people in nursing homes. We're starting to get there. The risk to our community is already lower because of the number of nursing home patients that we've gotten vaccinated. And again, getting about a third of 65 and older vaccinated in our community starts to take the pressure off of the risk to everybody, to the hospital getting too full and those kinds of things. So starting to feel some relief. The light is it can be seen at the end of the tunnel. We're not there yet, but it's getting better.
And probably, again, important to mention, even though vaccines are rolling out, that's one of the mitigation strategies. In the meantime, what should we be doing?
Nothing has changed from what either public health or any providers would say, is that we should be protecting each other by wearing masks, watching our distance, not gathering in mixed groups of people, and of course then hand hygiene and those kinds of things. Until we have widespread community vaccination and the numbers of infected people drop to negligible amounts, those would be the things that we would recommend.
Great. Well, thank you both. I am going to throw a slide up here. There are a lot of great resources out there. South Central Public Health's website has information on local data and statistics, as well as connections to information on the vaccine and what you can do in the future. The State of Idaho coronavirus page is great. I showed earlier the health and welfare site of kind of when and where to get your vaccination. That's updated pretty regularly with new information. The CDC obviously has good information. And then St. Luke's has a site that really kind of compiles all of their COVID vaccine information as well. So check those out. Again, our intention is to do these on a somewhat regular basis. So we will get the word spread as best we can when the next one is planned. I want to thank Dr. Kern and Logan both for being with us today, and St. Luke's and Public Health for being good partners with us. And with that, we're going to wrap it up, and thank you all for being here.